Mr. Larson is recognized.
Yes, thank you, Mr. Chairman, and want to associate myself with the remarks of Chairman Neal. With this exception, I'd like to throw in the Sisters of Notre Dame as well for the work that they have done tirelessly. And yeah, I hope there's a direct path to heaven for me, Mike, on that. So, and also Mr. Thompson's comments. And Mr. Guilford, I wanted to ask you, in your 7 principles, and I believe you were in the process of answering Mr. Thompson's question, you indicate in one of your principles, create an all-payer payment system using administrative pricing. Could you elaborate on that, et cetera, what you mean by that? And how would that impact everyone's concern that there be transparency, and how will that better help the healthcare system overall?
Certainly. By administrative pricing, I mean prices that are established by administrative edict, if you will, as we do with Medicare and Medicaid. And the largest privatized health insurance program in America, Medicare Advantage, actually uses administrative pricing from Medicare, and it's the only reason it's successful. So, but the proposal is, rather than allow the marketplace to establish rates for paying hospitals, which is what we have experienced for the last 40 years, the result of that is extraordinarily high prices because employers insist on having certain hospitals in their networks. That just has driven up prices. The marketplace is broken. It's not like shopping for cars. Every patient's needs are different. They occur as emergencies. They're unforeseen. The vast majority of dollars as one gets older are not related to shoppable services, but to acute events. And the reality is that's what's exposing people to these high prices. So I believe establishing a set of prices that are the same, whether you're a safety net provider or a provider in Bryn Mawr, Pennsylvania, in a high-income community, we should not differentiate how much we pay hospitals. We should, as we do in Medicare, we should pay them according to a set fee structure. In doing that, we will significantly decrease the exposure that people have to these high prices. And finally, as I said, I would eliminate deductibles because they're actually causing people to avoid care. And differentially, poor people, lower income people are actively avoiding care, and well-to-do people, the limited number, only 17% of all Americans have an HSA, the very limited number of people that do are paying for it through their tax-exempt spending accounts. So once again, we are asking low-income folks to shoulder the burden of shopping and going out, even when they are sick and vulnerable, to get complicated services that, as Congressman Kelly points out so clearly, oftentimes are emergencies.
You also said that you would continue transparency efforts to collect information on costs and outcomes, which seems to be universally agreed to with everyone on the respective panel, and outcomes of care utilizing tools like patient-reported outcome measures. What are PROMs? Could you?
Yes, it's simply calling you and asking you after you've received a service, how are you doing? Not just were you satisfied, how are you doing physically? Are you better as a result of your hip surgery? Are you walking more? How fast did you recover? Those are patient-reported outcome measures. We don't do much of that, unfortunately. We tend to rely on very narrow metrics that allow people to perform to the test, basically, as opposed to whether or not our patients' experience and outcomes are what they expected. So that's what PROMs are.
Keeping in mind also the issue of transparency, I do think, Mr. Chairman, that we have to be transparent that why we're having this hearing, and while I'm sure many Americans across the country are tuned in, what they're concerned about most is the fact that we are about to default on the dollar. And we have a responsibility in this committee to deal with the debt ceiling. And we have millions of fellow Americans, 66 million Social Security recipients, concerned and wondering whether or not they're going to get their check. That's what we should be focused on. I yield back.